While this story could be called How I Almost Named My Son After a Hurricane, instead it tells the story of what inspired me to spend my public health career addressing vulnerabilities in maternal and child health. On September 16th, 2004, 2 days after delivering my first child, I was discharged from an Atlanta area hospital into the aftermath of Hurricane Ivan. Now, in my postpartum haze, I had no idea what havoc this storm was about to unleash in our lives. At that time, Hurricane Ivan was one of the most devastating natural disasters ever to hit Georgia, producing widespread tornadoes, power outages, and tornadoes throughout the coast of Georgia. So what should have been a 20-minute ride home took 2.5 hours. At one point, my husband over here pulled off the side of the highway so that I could nurse my newborn son in the car. When we arrived home, we learned that we had no power and, worst of all, no air conditioning. And as you know, in Atlanta, in early fall can cause unrelentless humidity. So the next part is a little TMI, but I thought it was important to share that my newborn son at birth weighed 10 pounds, 14 ounces. Yeah. So just 2 days earlier, I had delivered an almost 11-pound baby. Yeah, my first. So what this meant was that my son was hungry all the time. So as the downpour continued, amidst the darkness and the heat, we hurried to get settled into the house. So for the first hour or so, I tried my best to breastfeed by candlelight, but through tears, sweat, and frustration, I just could not function. So I asked my husband, pleaded, maybe demanded, help to get out of the house. And luckily, we were able to check into a hotel where safety and electricity comforted us through our first night out of the hospital. This aha moment of breastfeeding by candlelight turned into my career, inspired to address disparities in maternal and child health. Unfortunately, being a new mother, going through the nightmare of a natural disaster is not a unique or an unusual experience, but it is in fact a dangerous one. History has shown that pregnant and postpartum women are particularly vulnerable during emergencies. They have functional needs that require additional social and healthcare-related support, including prenatal and postpartum care and lactation support. Evidence has demonstrated that emergencies can cause heightened stress among this population, often leading to adverse maternal and infant health outcomes, including miscarriage, premature delivery, low birth weight, and mental health challenges. These were the experiences of many women who were pregnant or delivered during several natural disasters, including Hurricane Katrina in Louisiana, Hurricane Harvey in Texas, and most recently Hurricane Helene in North Carolina. And we can only imagine what we will learn from our Hurricane Melissa that just happened in Jamaica a week ago. There are other types of emergencies that mothers experience that are both harmful and preventable. For instance, extreme heat during pregnancy has been shown to increase women's risk for severe maternal morbidity and adverse infant health outcomes. The COVID-19 pandemic shed light on the importance of maternal immunization to protect women from complications of infectious disease during and after pregnancy. Even human-caused disasters, such as those caused by bioterrorism, think 9/11, have been shown to have long-lasting effects on mothers and their infants. Through my work, I partner with public health agencies and community organizations to create strategies that improve maternal and child health, emergency preparedness planning, and response. Just recently, I worked with my collaborators from the Georgia Department of Public Health, the Morehouse School of Medicine Center for Maternal Health Equity, and Maternal and Healthy Mothers, Healthy Babies of Georgia to complete Project Prepare. Project Prepare was a CDC-funded study of preparedness and readiness for emergency planning among pregnant and postpartum women in Georgia. Our findings reveal that mothers in Georgia are often disconnected from their healthcare providers for essential information and support before, during, and after emergencies. They also lack essential financial and social services during emergencies that are needed to ensure healthy outcomes. These findings are especially important in Georgia, where women experience among the highest rates of maternal mortality. As both a women's health advocate, a health services researcher, especially as a mother, it is my mission to address the vulnerabilities that women experience, particularly during the perinatal period. It is both my purpose and a call to action that I take on both willingly and in these challenging times with unwavering resolve. So I dedicate the story to my firstborn son, Will, or Ivan, as he is fondly and sometimes called. So thank you very much for your time.